I live in Denver, and my dad lives in Orange County. He has a history of stroke, so I was really happy when he gave me access to portions of his electronic medical record. This allows me to monitor his health right from my home computer. It's wonderful, really comforting.
At St. Joseph Hospital, healthcare can be this easy. For the past few years, we have been working with Microsoft and Cisco to develop a safe, secure, highly efficient, and totally paperless patient experience. For our patients, this means better communication with their doctors, less time waiting for test results, less paperwork to manage, and best of all, the peace of mind knowing that all their medical information is in one safe, secure place, available online 24 hours a day, anywhere in the United States. This is not space-age stuff. This can happen today. Honestly, this is how healthcare should be delivered.
Hi, Mr. K. How are you doing?
Good, thank you.
Good to see you.
Good to see you.
How have you been?
Good.
Anything new?
No.
No, any problems?
Through the expansion of electronic medical record technology used by St. Joseph Hospital and affiliated doctors, patients can take a more active role in their health. They can track their medical history online, view test results, and even consult with their doctors.
No.
They can do all this through completely safe and secure web portals. And best of all, the patient controls who has access to their medical information and how much information each person has access to. It is completely up to the patient.
Because of the history of stroke, there is an association between heart disease and stroke. So I'm going to refer you to a cardiologist, Dr. Chan,
Okay.
for further evaluation. And I'll be able to monitor your progress online.
Okay.
Does that sound like a good plan?
Sounds good.
Very good. It was very nice to see you.
Good to see you. Thank you.
Bye-bye.
Technology has greatly increased the efficiency of healthcare. Thanks to Health Presence, developed by Cisco, distance is no longer a barrier to accessing great medical care.
So all the heart studies look great. Now the carotid ultrasound study that we did to look at these carotid arteries did show a bit of a problem. You've got a history of stroke in the past, and that raises concern for another stroke. I'd like to get a vascular surgeon board. We have an excellent one we work with, Dr. Montgomery, who's currently in Tokyo right now, but we can network him through this teleconference room as part of our Health Presence network. Okay, so let's get him on the phone.
Okay.
Dr. Montgomery,
Hi, Dr. Chan.
good morning. So I have Mr. K here with me, who I told you about previously.
Through a life-size, ultra-high-definition video image, doctors and patients can have a face-to-face experience when they might be hundreds or even thousands of miles apart. And the secure transmission of data, like X-ray images and test results, allow doctors to view data in real time, as if they were in the exam room with the patient.
Yeah, the images are quite clear. Dr. Chan, I definitely share your concern. There's a significant blockage in the carotid artery. Mr. K, there's some issues here that I think we need to talk about. I don't want you to worry, but I do want you to come and see me next week when I get back into the United States.
Okay.
It's easy, convenient, and offers faster, more efficient care. It's the way patients should be treated.
This is our Microsoft Surface, and if you have your card with you.
Technology has also made patient education more hands-on and interactive. Microsoft Surface is a revolutionary multi-touch computer that responds to natural hand gestures and physical objects.
Is the traditional carotid endarterectomy procedure. Now, this operation has been around for a long time. It's traditional.
When placed on the screen, objects trigger different types of responses. For example, patients can place their medical card on Surface and gain secured access to their medical records. They can also grant the doctor access. And the large display makes it easy for several people to gather and share information. It's basically face-to-face computing without a keyboard or a mouse.
Mr. K, I know that's a lot of information, so I'm going to stop right now and just ask if you have any questions at this point.
Well, after this procedure, will it require a lot of follow-up visits?
It's going to require regularly scheduled follow-up appointments. We're going to make arrangements with Dr. Elihu, not only for monitoring of your stent procedure, but also for monitoring of your blood pressure.
Don't worry, Dad. Remember when you created your electronic medical record? You granted me access to it so I could monitor your health from home. I can send emails to your doctors, view your test results, and monitor your medications too. So don't worry about it. I just want you to concentrate on getting healthy.
Okay.
Technology in the operating room is getting more and more efficient as well. Thanks to the generosity of our donors, St. Joseph Hospital recently opened the country's first true hybrid operating room for the treatment of heart and vascular disorders in adult and pediatric patients. The room's robotic technology and three-dimensional imaging allow surgeons to open blocked arteries through a catheter-based procedure rather than opening the patient up. This means fewer complications, shorter hospital stays, and a faster recovery. When your loved one is in surgery, there's no worse feeling than waiting. To help alleviate some of the stress, family members can now track their loved one's progress using technology developed by Spinatar. Patients are identified by number, so confidentiality is maintained while keeping loved ones informed. It's a very compassionate service.
Hi, Mr. K.
Hi, Doctor.
How are you?
Good.
Feeling well?
Yes.
Good. Well, let's take a look at everything and see how you're doing. And as you can see, the flow through the artery looks terrific. I'm not seeing any kind of re-narrowing. Quite pleased with the results. Do you have any questions?
Yeah. Well, I still have to take my blood pressure medication.
Yeah, I still want you to take your blood pressure medicine, and I still want you to take that medicine that I prescribed for you.
Communicating important medical information with loved ones and caregivers can sometimes be a challenge, especially if you're not feeling well. Giving a loved one access to your electronic medical record can help reduce the stress of managing your healthcare by yourself.
I just got an email from your daughter from Denver, and she had the same question. And it's great that you gave her access to your medical records because she can also see this visit, and she'll also see my recommendations for your continued medication regime and also for your follow-up visits.
Great.
Good. How's the golf?
Up and down.
It's reassuring to know that when you're not feeling well, you can rely on others to help.
If you have any questions, you call me. Otherwise, I'll see you again in 6 months.
Thank you.
Yeah, you're welcome. Take care.
Yeah. I emailed your doctor and your test results look great. Yeah. You take care of yourself now, Dad. Bye.
Healthcare needs to be this easy. With your support, it will.